866.
Helping make your life easier. Moms Every Day.
Good afternoon, everyone. We're glad you're joining us today for Moms Every Day. We are talking today with Dr. Nathan Vaughan, who is a cardiologist, and we're glad you're joining us to talk with us.
Thanks, Taylor. I'm delighted to be here.
Well, we're interested to talk to you today about our topic, which is cholesterol and kind of how to keep that in check, because that is something that a lot of people deal with. So first things first, kind of break it down to the basics for us. What is cholesterol?
Well, cholesterol is a waxy material that's in the body. It's in cells everywhere. Mm-hmm. It's not bad always. Some is, and too much is bad.
Too much of a good thing can sometimes be a bad thing. So, doctor, now let's talk about our cholesterol numbers. When you're looking at those, what do they mean, and how do you tell if somebody does have bad cholesterol just from looking at our levels?
Well, over the years, through studies, we've learned what really normal cholesterol should be. Mm-hmm. And actually, a total cholesterol of less than 200 is really considered normal. Now, that total number means it's a combination of good cholesterol, bad cholesterol, and another fatty substance that circulates in the blood called triglycerides.
Okay, so certainly something that we need to be trying to keep in check. So, doctor, if somebody at home is watching and they think they may be dealing with an issue with cholesterol, they're not sure, what are some signs they need to be looking for? How does somebody know that this is a problem for them?
Well, it could be because they know other individuals in their family have had a problem, particularly someone who might have had a problem with their heart, say in their 20s or 30s. That might indicate that that family has a particularly high genetic variation that causes them to have high cholesterols and events in life much earlier than we would expect people to have heart attacks or strokes and that sort of thing.
Is this something that you are starting to see kind of at a younger and younger age, that people are dealing with these kinds of issues?
Well, the genetic variation, not so much. That's really a fixed variation. It's about 1 in 250 individuals have that. What we're seeing now is the trends toward obesity, diabetes, and hypertension in adolescence, and diseases in adolescence that we didn't see until patients were in their 40s, 50s, or 60s.
Oh, and I feel like that's something that's very common in our area, too. That's something that we really see as far as the tri-state area is concerned.
Absolutely. Appalachia is rife with obesity.
Oh, doctor, now let's talk about how you go about treating this. Is there a way that you can kind of get people's levels in check? Is there any medicine that you use, or how do you decide how you go about treating somebody who does deal with high cholesterol?
Well, the American Heart Association has been involved in this for decades, and recently published guidelines just this year indicate that the fundamental way to help individuals control their cholesterol deal with lifestyle changes, and that means diet, activity, weight loss. Those are the fundamental underpinnings of how we treat cholesterol. Now, for those who don't respond to those measures, then we have a number of drugs that can be utilized to help lower cholesterol effectively and reduce risk for cardiovascular disease.
Well, you said that involves a lifestyle change, and sometimes we all know that's not that easy. Having to change your habits and change your eating routines, it's not the easiest thing in the world to do.
Oh, absolutely not. And even the American dietary guidelines say we should begin to make shifts, change one thing. Don't have that sugary soda.
Sure.
Use flavored water instead. Low calorie, low sugar.
Moderation too, you know, and like you said, don't jump in all at once and try to change everything all at one time. Just do it in moderation, which is, you know, easier too. So, you know, let's talk too about when it comes to thinking about cholesterol. Like you said, you're seeing this at a younger and younger age. Is it ever too early to think about trying to take care of your cholesterol and eat healthier? Because I know you said you're seeing this in people at younger and younger ages. So is it ever too early to start thinking about this stuff and start to try to make those lifestyle changes?
It's never too early. It's never too early. As a matter of fact, if there is a family that has that, it might be prudent to check a child's cholesterol at age 2. And certainly even adolescents somewhere between the age of 9 and 11 probably should have their cholesterol checked by their pediatrician, and then maybe repeat it again at 17 to 21 or so to see if there's been any change, because we're talking about diseases that occur as a result of a lifelong high cholesterol bathing the arteries and getting disease started in the arteries. We know from pathology studies that adolescents who died for other reasons have fatty streaks in their arteries at the beginnings of what will cause heart attacks 10, 20, 30 years later.
So you can catch it very early and then hopefully get it in check, and that'll make some drastic changes for you eventually in life too. So.
Absolutely.
Well, doctor, we appreciate you stopping by. Thank you so much for joining us.
Thank you.
If you at home would like more information, you would like to get in touch with Dr. Vaughan and his team, we'll have his information posted for you on our website, wsaz.com, and we'll also have this interview with him there for you. Thanks for joining us today for Moms Every Day, everyone. We hope you have a great day.